Well, this next rock star, and I say rock star because he is one cool dude, and you'll see this. And the topic that he's talking about is perfectly situated for what we're doing here in our conference and what's been going on in the world. Dr. Winkler has been involved with Best Answer for Cancers for years. He'll be sitting on the doctor's panel with me next coming days. And he resides in sunny California. Please show your welcome appreciation for Dr. Juergen Winkler. So, Juergen. Sorry. Back. Please put your hand for Dr. Juergen Winkler. Sorry about that. How are you doing? Good. Good to see you. Which mic do you use? You can use that mic right there. And here's a clicker. And Mike, do you have his slides? Cool. Dr. Juergen Winkler again. Thank you.
I was going to take half the stand up. Okay, so a little change in topic. Initially, this was going to be a presentation on cancer incidences since people have gotten a COVID vaccine. And if you actually look online, you're going to hear a lot about it. I probably have listened to multiple podcasts. And then I asked myself the question, excuse me, where's the data? People will talk about what they've noticed. I've read articles, even Dr. Blaylock, one of my more favorite wellness reports, mentions turbo cancer. And I don't see any real evidence on the data, because I tried to look up some of his references and I can't find it. So last minute change in topic to talk more about COVID and the COVID injection, as it was referred to earlier as not quite sure it's a vaccination. I call it the jab. And then we talk about the injection problems and some of the long haulers and how we're in our office are handling some of the long hauler problems, which also dovetails into a lot of cancer type treatments as well. All right. So the definition of a vaccination. So if you actually go back and look at it, I have an encyclopedia that predates the internet. And 1970s, I have Funkenwagner's encyclopedia. And that definition is talking about what really happened with the original vaccines, which started in 1796. A couple of points I want to make clear about that is that what happened is that women who were milkmaids had developed resistances to getting smallpox. So they had their hands exposed to cowpox, and they were able then to develop some immunity towards smallpox. So the experiment was done on young children to take scrapings of that cowpox and rub it on the skin of young people, and then later on expose them to smallpox, and it worked. So if you keep in mind skin-to-skin transmission, if you want to get a flu, you want to avoid the flu, you take a flu vaccine, provided you have the right strand and it's clean. The best way to do it is by what? Nasal spray, right? You don't necessarily need an injection. I think giving an injection bypasses our immune system. And all of a sudden you have a shot in the arm and you're like, okay, the immune system, well, where did that come from? It sort of bypassed everything. Next thing you know, it's sort of shock, and then the body has to respond to it. So this is what you see initially, and it's defined back in, let me see how we change the order of my slides. So you guys have this? All right. So this is the original Funkenwagner's. They really defined vaccination. It did not define vaccine per se, but it was essentially modified inoculation, and that was what they had done. So the vaccine definition, which is what they're using today, is really the administration of an injection, okay? Because there should be other ways in which we administer it. An antigenic preparation of typically inactivated or attenuated, weakened type of pathogen. And it also now adds in components of those things, products such as proteins or toxins. And then that is also the next part now, which goes along with what we have today in our COVID vaccines, is the preparation of genetic material such as a strand of synthesized messenger RNA that's used for the cells to body produce an antigenic substance. So we have a complete different definition, as you can see how this is the evolution. So this is today's definition. This was back in the 70s, where they took the information from history. 2003, we have a definition of killed organisms, live or attenuated. and we were trying to do something to produce immunity. 2021, similar definition, but now they're talking about some of the counteracting effects of its products, but we're also trying to figure out, is there some additional things being added in? So Townsend Newsletter did an article many years ago on what's in the vaccine, and when you actually look at it, there's just fewer and fewer components that actually would trigger an immune response. It's more like other excipients, and everybody knows about thimerosal, aluminum hydroxide. There are other things being put in this to suppress immunity, which sort of defies the reason why you take it in the first place. So 2025. So now there's multiple people trying to redefine vaccination, and they're making other comments about what they're using. Now they're using non-infectious substances. And Moderna actually came out and described it as well, injecting a small piece of messenger RNA from the coronavirus to create the viral spike. And then but if you also notice when you look on researches, you're going to find lots of people talking about this definition. So it's sort of like, well, if you say it enough times, it all of a sudden becomes true, right? Just ask Nancy Pelosi, that's by her own comment, that's how she figures stuff out. All right, and I'm commenting on her, she actually said it, so I'm not saying anything bad. So the vaccine definition continues, and here we're finding about other types of components and things that are being added in. So when we look at the vaccines, most of us know, okay, I keep calling it an injection, okay, so by the old traditional vaccine definition, it doesn't fit those criteria. But the new one, they sort of simply added a few things in, and now all of a sudden we're incorporating it to sort of make do with what we know now is occurring. So we're all familiar with Pfizer, Moderna, Johnson & Johnson, AstraZeneca, right? So AstraZeneca actually voluntarily withdrew itself. Johnson & Johnson was stopped by the FDA. Did you know that there's still 36 other types of vaccines that we probably did not know about, which may have been actually better, but who knows? So if you look at the world distribution, you'll see that there's other vaccines that were being used, and you can see how the predominance on us, where's the red mark over there? Yeah, no, I got the button, it just doesn't seem to show up on the screen. So if you look at ours, you're going to see predominantly what we received, right? So it's going to be Moderna, there's some Janssen. So basically, but look at Russia. It's all red. What did they get? They got Sputnik Light. Not very original in names, but at least we know where it came from based on the name, right? So, but where did we get? We didn't get exposed. We didn't even hear about these things, right? We were doing research on this. So this is the other one. So some of these are subunit vaccines, or they're actual adenovirus vaccines that were attenuated, and so they made different types of vaccines. But you can kind of see where we fit and what we received is completely different than what a lot of the rest of the world received. All right, were they safe? Where's the data? So you'll see that there's a lot of data, and I kept asking myself, wait, is there a rise in side effects? Is there long-term effects? Nobody knows. Is there some evidence to show that? But the CDC all of a sudden gives us information, and all of a sudden it stops. Just doesn't want to give us information. So we go back and we look at what's actually in the ingredients of these things, and you're going to see they start making these things more lipid-bound. So some of these ingredients are basically trying to take this messenger RNA and put it into a lipid. So the reason that you put something in a lipid is to get it to penetrate the cell better, right? So if you get to penetrate the cell, the messenger RNA now creates proteins, and spike protein, but it also goes backwards and it recodes your DNA. So this is where I think we're having some problems. So both of these vaccines, although they're slightly different ingredients, they also use things that are lipids, and they're trying to encase the messenger RNA. So you can see these arrows here aren't lit up well enough, but you can see them if you actually get the slides. You can take a look at that. So you're actually seeing the messenger RNA lipids, and that's a common theme throughout these types of vaccines. But they're adding a few other things in there. But they don't tell us everything, because I remember hearing about graphene oxide. Okay, so here's the Moderna one. And this is also using forms of polyethylene glycol. Most of us know about that. Miralax or other types of medicines are dissolved in polyethylene glycol. It makes it more soluble. right? So here's some of the sites that I was using to kind of try to get some more information. All right. So the other one that became kind of ethical, that stopped a lot of people from wanting the vaccine, was there's some type of a human kidney component. And that's not mentioned on AstraZeneca's website on what they put in it. You have to dig a little bit. The other one is graphene oxide. So obviously a lot of us have figured out that if you really want to know what's going on, get your information from social media, right? I can't help it, but the news isn't telling us everything. And the internet's not telling us anything either, because I embarrassingly went to AI and said, oh, this will be an easy presentation. Just pop it in AI and we'll spit out a bunch of slides. And here I go. So actually embarrassingly, nothing showed up. But AI referred me to snoops.com for the sources of information, and they referred me to FactCheck and said, oh, yeah, there's no information that COVID vaccine causes any problems or any long-term problems. Oh, okay. So now comes the work. Julie sent me tons of links. I'm listening to lectures. And again, you're trying to find information that is some data-based. So nothing's coming from the government and nothing's coming from the universities where we would typically get our information. So graphene oxide, unfortunately, I listened to a 1-hour-long lecture by a Austrian chemist, and within a day he was dead, alleged suicide. And he talked about how nasty this compound was, and it was like a razor that caused problems if it was injected in the body. So, not mentioned anywhere as an ingredient on any of these injections. So this is all they list for their side effects. I threw in there myocarditis, anybody?
Yeah.
How about sudden death?
Yep.
Right? So we know these problems are happening. We've seen young athletes fall over for no reason. Well, there's a reason. But why are we having these problems and no one's talking about it and we can't find data? I tried to find information on all these side effects, even myocarditis, and when you do that, you're going to get about 700 pages of information on the internet. The first 30 pages are all going to be sponsored ads. Where's the data? Pretty frustrating. But you can listen to Dr. McCullough, you can listen to Dr. Artis, you can listen to frontline therapy doctors, you can listen to them, and they'll all tell you what they know they're seeing, but no one's saying no one's showing the data, and that's what's the frustrating part. Right? So I've come to the point that I've gotten a little paranoid. I don't trust any 3-lettered government agency any longer. So beat me up later if you don't agree with me. All right. So the CDC data, is it reliable? So I have concerns about it because the CDC data stopped somewhere in 2021 when they realized the side effects were off the roof, and I'll show you that slide they actually produced. So here you see the incidences of COVID deaths, and you have kind of your timeline, and all of a sudden you get 2021, look what you got. That's the first admission of anything from a government perspective that I'd seen. I thought that was kind of interesting. But what happens after that? The information disappears. Deaths reported from VAERS, right, the Vaccine Adverse Events reports. They say this is about 10% of what actually is being reported is actually showing up here. And here's kind of what you see spread out a little bit over the time from January 2021 all the way through August. And you see a huge increase, a huge spike. Okay. So if you ask yourself, what was this whole process and why do we have these COVID injections given to us? Was it an agenda, or was it really just good science and we were trying to help the population? I chose the former, but it wasn't successful. If 80% of our population received the vaccine, received some form of a vaccine, worldwide 64%, that's a pretty successful campaign. Would you agree? It's a lot of people. And what do we know about what's going to happen in the long haul? If they keep doing what they're doing, we're going to be very busy. So short-term health consequences, long-term problems, and we're still looking for the data. So this is, again, a little bit more of the VAERS information. This is showing just what they found here in regards to the adverse events, over 600,000. There's probably more, right? When did they stop with giving their data, right? So here's another question I had, and I kind of challenged this, and no one ever answered this question for me. I said, so if we have COVID, and are we getting actual variants? And if we're getting variants, where's the source of that information? Who claims, and what lab says, yes, there's a variant, and here's where that actual variant occurred, and here's why it's different. But we heard about it, right? We all heard Omicron, and what's the latest variant? Okay, so when you actually go and see who gave out that information, it's the CDC and the WHO. The WHO quotes the CDC, and the CDC quotes the WHO. So, why are we doing this? So, their explanation is going to be more reasons for a booster, right? So, we got a variant, oh, we need a new booster. I'm a little paranoid, but it happens when you're in this field. So, long COVID. So, if you you type in information, Google, whatever, Yahoo, whatever search bar you use, you're going to find that Moderna pops up everywhere. They have lots of sponsored ads. So we look for some of their sources, and we know the symptoms. They're willing to say, yeah, long COVID. We've got some symptoms. And if you look at those symptoms, you're going to go, well, is that lupus? Is that something else? Is that just chronic inflammation? Where lies the problem? And of course, they gave us an explanation. They gave us some information as to what they think we should do with that. Give more vaccines. So if you got long haulers from the vaccine or from having COVID, you need more vaccines to make sure that you fix that problem. So getting the reliable sources of information was kind of difficult. So early on, when COVID first started, I had it myself in 2020, so I didn't see any reason for a vaccine or anything similar to that. I spoke with Stephen Edmond, and he's a very bright guy that actually worked for a couple of homotoxicology and homeopathy companies. And he developed a company called Viotrex, which is, I think it was in Canada or still is in Canada, but there's also a branch here in the States. He came up, and I talked to him for quite a bit, and he came up with a protocol. And that protocol goes through detoxifying the vaccine. And that's probably one of the easiest and effective ways in which we find that we're using here. And I wanted to bring that up because most people don't find this particular one. You can find a lot of different protocols on the internet for how to take care of COVID vaccine, and long haulers. But this one I don't think you're going to find a lot. But this one works. And in the process of what I do, I spend a lot of time doing applied kinesiology, muscle testing. We actually found a point on the body, which has been pretty consistent, that if you actually receive the vaccine, there is probably an acupuncture point right between the navel and the sternum. And that point halfway down will be weak. And so when we test people, we find that actually if it's weak after treatment, it gets stronger. So there's definitely some shift that's happening energetically in patients. There is did I just do something? There's actually 2 vaccines to which he has homeopathic treatments for. It's Pfizer and Moderna. And AstraZeneca, we found through low-dose immune therapy, we found a remedy that we can use homeopathically for that one as well. And then there's one for systemic detox. There's one for immune boosting. And interesting enough, he found a remedy that he could use called rDNA. Prevents the messenger RNA from backtracking and creating a DNA memory and unraveling that. For those that actually have and are actively with COVID, there is a C19 product that he uses, and there's also some long haulers products that he's using. There's BreatheX for those that are more prone to respiratory issues, and he has a graft product, which is intended to help remove graphene oxide from the body. So someone did a lot of research, came up with a lot of treatments, and unfortunately it's not very well known, but we like it, we use it quite a bit of it. I find also, while I was looking for it recently, it's hard to get into the store. So I know we have a ton of product, we dispense a lot of this because we got people that need to get rid of it before they get their cancer treatment. So one of the more common treatment protocols, right, the FLCCC, they've got a huge recovery program. Right? Ivermectin, I think there's probably still ongoing use of ivermectin even in cancer, even in viral disease prevention. Prednisone, low-dose naltrexone is quite common. There's some protocols, you start with maybe 1 milligram or 1.5 milligrams, you go up to 2.5 to 3.5 to 4.5. Sometimes I get lazy, I just do the 4.5 unless people tolerate it. If they don't, then we can back down and then raise the dose again. Right? Fatty acids, omega-3 fatty acids, vitamin D, I think this kind of makes sense. All right, so common problems. Somebody gets their vitamin D level over 100, and some doctor says you're toxic. I go, wait a second, toxic? I go, mine runs at 100, 120. I've got patients that on their own have gotten up in the 200s to get their levels very high. I'm not sure what the clinical benefit is, but you're not toxic unless you are sick from something, correct? So getting your vitamin D levels to 100 to 120 is not unreasonable. And it's easily done with 10,000 units a day if you're consistent. Fluoxamine. So this is an antidepressant. It actually has, at low dosages, has some really nice antiviral effects. But torvastatin, not a big statin fan, but I know talking to Jane McClellan, she seems short-term curses of that. You're trying very hard to change my mind on that, but thank you, Jane. This is an anti-AIDS medication. This is an AIDS drug. So I think it's very expensive, and I'm not going to be the first one to want to use that. So some other things, curcumin, right, Nigella sativa. So you have other herbs that you can use to help with inflammation. Vitamin C is helpful. I usually go to powdered C. I think you can get a lot more in that way. Or you use liposomal C. 1 gram of liposomal C is about 7 grams of oral C, so it's much easier to get your levels higher. Melatonin. I go much higher on the dosages of melatonin. I think we talked about that a little bit last night in Jane's workshop, but the melatonin dosages is really recommended as an anti-aging. Health promotion is to get to at least a milligram per kilo, roughly, body weight, or let's say for every 2 pounds you can do 1 milligram. So I've taken as much as 200 myself at times, but 60 to 80 milligrams on a regular basis is not a bad thing. Kefir, probiotics. Oh, that's good. So, behavioral modifications, mindfulness. I spend a lot of time with patients on neuroemotional techniques, so I'm really working on trying to cleanse people of guilt related to taking this. You can imagine being forced to take it. There's actually 2 lawsuits happening in San Diego area. Rady's is a very large, well-known pediatric hospital. They're suing. The employees are suing the hospital for forcing them to take the vaccine. And Kaiser is the second one in that. It's going to be named in that lawsuit. And one of my nurses actually left Kaiser because she actually was fired because she didn't take the vaccine. Another medication, luteolin, quercetin. I think the dosages are a little bit low. I probably would raise the dosages to get more of a clinical effect. There we go. So one of the things that we found is we have this with any patient that has health problems, is when they have a vaccine, any vaccine, or any particular type of other therapy, or they're taking a medication, they have side effects. The biggest problem is they're toxic. So almost every patient that comes through gets a standardized treatment to determine from urine collection what they're actually being exposed to. So chelation to pull out heavy metals, we use lipostibule or essential, which is the phosphatidylcholine, followed by 2 grams of glutathione. And everybody gets the same treatment, so we have a standard basis of information as to how much toxins they're dumping. All of our patients are going to be mold toxic. All our patients have heavy metals. If you live in California, you will know that the air is not very clean. Now, it's not just I'm not near LA, so we know about smog, but you will actually know that there's tons of streaks in the sky. In fact, occasionally they spell out a word, or they try to. I remember seeing one going S-H-I, and I think the last letter was left up for my imagination, but it was too far over the ocean, I couldn't see it. So it's kind of comical, but we do see these types of stuff. And what's actually even more comical is that I went back to my Funkin' Wagnalls and I asked about clouds. So there were 4 major clouds talked about in the 1970s. And then about 2010, all of a sudden we have 6 different types of clouds. Now we have 10. 5 of them are very linear looking. When was the last time you saw straight clouds? Well, come to California, you see plenty. So we do see that as an antitoxic burden. I will tell you that since Fukushima happened, we've seen a lot of cesium or radioactive cesium. We don't know if it's radioactive, but there is cesium in people's heavy metals testing, which was not there prior to 2012. We do a lot of detox. So our patients get a lot of PK protocol. So this is a very good detox protocol for fixing neurological issues, mold toxins, heavy metals, environmental pollutants. Right? We see a lot of glyphosate, a lot of EPA, a lot of pesticides in patients. And they don't even know where they got it from, but we're getting exposed to a lot of these things. The PK protocol is very unique in that phenylbutyrate is used because butyrate, short-chain fatty acid, repairs mitochondrial cell damage. So it kicks out the bad parts of the cell, which are then utilized by the mitochondria for fatty acids to make energy, and then the body can begin to repair those cells. So that's then followed by phosphatidylcholine, which makes things after liposomal. So we actually put that phosphatidylcholine in the beginning part of the protocol so the phenylbutyrate gets into the cell better. And then we follow with glucagon and glutathione, and we see people purging quite a bit of toxins. And that's how we help get people cleaned up from a lot of long haulers and a lot of other toxic burden issues, particularly in cancer as well. The other one, oxidative therapies, we do a lot of EBU. We purchased the machine probably about 2 years ago, and that's like the #1 treatment we're giving as an oxidative treatment. We've done the Zato machine, we've done ultraviolet light, we kind of couple some of these therapies together, but EBU is really cleaning out patients and removing a lot of the inflammation. And of course, we put people on some forms of low-dose naltrexone and ivermectin, and of course we have intravenous curcumin, quercetin, other types of things, and then we can photodynamically stimulate it. Also do a lot of methylene blue. So we do it intravenously as well as orally, and we can then activate it with light. Did I go too fast? Let me see. Okay, so a couple of stories. I think we can see now there are some things coming out a little bit more. You can see the date on that, so that's actually within the last week of information coming out. As I'm sitting here getting, over the last lecture, my wife texted me an Instagram comment, and she said there's actually something coming out about, from Yale University, there's a study saying that all of the long haulers is related to the vaccine. Like, oh, someone's finally being honest. So we're finally getting there. Now everybody that's in the community that knows and looks at Instagram and looks at X and looks at all these different types of social media platforms, we're getting a lot more information, right? I mean, Substack has a ton of information, but it isn't always data-based, and that's kind of makes it harder. So where's the future lie? I hope with this new administration, with RFK Jr. in charge of the FDA, we're going to see maybe some more truth. Let's hope we do. Is there an agenda behind this? Corruption, controversy? We're kind of all in the middle of it right now. So kind of was the essence of like, hey, there's information out there. I don't trust it all. Kind of gave me some ideas of what I came across. I'm sure other people have had their own experience looking at a lot of this material. And that pretty much concludes what I was going to talk about today. So, thank you.
There has to be some questions on this topic, no? Do not be shy, and that's why I said Juergen was a rock star coming up here and covering this, so. Come on down. Come down, please. Anthony, here we go. Dr. Rufo.
Yeah. So I'm not sure it's a question, it's just a comment to corroborate with what you've been saying. Having practiced in Florida through COVID at an urgent care here as a physician, Florida is a very free state. So we had monoclonal antibodies in every city, multiple stations, and people from Pennsylvania would call me and say, what do? I have COVID. They would go to your monoclonal antibodies. What's that? You know, I mean, the only way we could get treated is they could go into an emergency room and they were told, don't do anything, you know, just go home But the interesting thing, doctor, I just wanted to say was two things that just came out in the studies. Number one, that the Journal of Infectious Disease just came out with a study saying that they studied over 160,000 patients who were treated with ivermectin for COVID, and they realize now, okay, that it decreased mortality. This week, just this week, JAMA came out and said that if you have COVID, and we've obviously, down here, we're allowed to prescribe ivermectin, okay, in Florida, and fluvoxamine, not fluoxetine, fluvoxamine, we're allowed to prescribe it. And if we were forced to get a vaccination, which I didn't, but if people were being forced, there was a $5,000 fine to businesses in Florida that were forcing their people to get vaxxed.
Thank you to Ron DeSantis.
Yes, yes, thank you, right, God bless him. So anyway, now JAMA just came out saying that now Paxlovid, which costs $1,650 for 5 days therapy, compared to ivermectin, which costs about 10 cents, okay, that Paxlovid, if you take Paxlovid for COVID, if you've been immunized, doesn't decrease mortality. It basically does not decrease mortality. That's JAMA. Okay, so now they're saying ivermectin works, decreases mortality. Paxlovid doesn't decrease mortality if you've been immunized. Interesting, isn't it?
Quite interesting. Yeah, thanks for telling. Yeah,
Sure.
talking about that, I would love to see those articles.
I'll get them to you.
Thank you.
Thank you, Doctor.
Hi, thank you so much for all the information and saying it out loud. Do you have anything to add for vaccine shedding? What can be done? And I know we hear about it a lot.
So I don't know 100% the full detail of that question, but I do know there is viral shedding. The FDA does know about viral shedding of all vaccines. So there is viral shedding. And it's interesting, I came across an article. There's actually a certain type of a black light that you can get and you run it across people's forehead. And you can actually see little type of things that light up and they're actually virally shedding. So you might want to do that, pre-screen your patients when they come to the office and say, oh, you need to leave.
Right.
You're positive. So that is a problem. I don't know how long it lasts. And people have kind of drugged this out and said, well, this is happening for a long period of time. I think it's a short period of time, but I don't know for sure.
I see. Thank you.
Hi, my question is, my sister was started on a lot of these detox treatments, ivermectin, low-dose naltrexone, methylene blue in combination with red light therapy. She wasn't tested for any kind of mold or anything before that. Is that standard to start this before doing testing, or should testing be done first?
Well, I personally think you should test first.
Yeah.
Because I think you should know what your toxic burden is before you even start doing any type of treatment. Because again, the number one thing that's going to block those pathways to getting well are going to be heavy metals, toxins, and bulk mycotoxins.
Mm-hmm.
So we pretty much do that with almost everybody that comes through the door.
Okay. Yeah, because about a weekend she developed kind of severe gastritis and stopped everything because it scared her. So I was wondering if that was what kind of symptoms these detox patients have. We weren't sure if it was like a die-off reaction or something.
Yeah, kind of hard to say without knowing all the detail, but even if you could do something, and most patients are even just simply activated charcoal like 30 minutes before you have a meal away from your supplements, but you can easily do that because that's going to prevent the reabsorption of toxins from the gallbladder. So this stops the reabsorption, and we do a lot of homeopathic treatments, encourage a lot of people to flush the system, make sure their bowel movements are regular. I have a whole like 3-page sheet of what we do for patients, including the proper water intake, how much water they need to drink, getting the bowel movements regulated, whether you need to sweat, you get in the sauna. We have a niacin protocol for sauna, sort of a modified Hubbard protocol. So there's a lot of things. I'd rather get people clean before I start adding all these things back in again. Because it's kind of like this, if you're walking around with a full trash can and you don't empty the trash, what are you doing?
Okay.
You're putting in all these good things, but you're not really going to get the response that you want. So you're going to take the trash out.
Yeah. All right. Thank you.
All right, thank you.
Hey, Dr. Winkler. Well, just a comment on that. I actually thought I have patients that had long COVID, and when I test them, they have mold too, and they have MCAS, they have POTS, all this stuff. But that's just I agree with you. I guess it's testing first, but that's not my question. My question is, I know you mentioned about EBO in your part of your detox protocol. Any experience with EBO2? Because we've been using EBO2, and how do you incorporate that with the PK protocol?
So,
because the more EBO2 is like once every, we do it every 3 weeks, but can we do
one of the
more?
things I really want to do with people is to make sure what metabolic state they're in. So if they're dysaerobic, I stay away from ozone, right? So
Okay.
making sure they're not dysaerobic, which means they're actually, every time they breathe, they're tearing out, they're rusting internally. And if they're in an anaerobic state, then I'll encourage, which means they're more into glycolysis, less oxidative phosphorylation. And so then low energy producers, they do much better with ozone, so it depends upon where they are in their metabolic state. If they're anaerobic, you want to get them on ozone sooner because that fixes them sooner.
Okay.
And you also can fix the cell membrane with more sulfur. Thiosulfates will help.
Oh, okay.
So that helps. Again, I can explain to you later about how we do that. But there's a course that I spent a lot of time going through. It's in actually one of my lectures from Best Answer from Cancer like 4 years ago.
Gotcha. All right. Thank you.
All right. Thanks.
So, hi, thank you. I know remdesivir started out being given for 5 days, and then it started being given for 10 days, and they weren't even asking in the hospital, and they weren't letting families in. So I'm wondering, are there things that you're finding with remdesivir?
Oh, it's toxic.
Not really paid attention to that. Unfortunately, we don't see a lot of these patients. So I would probably think if they had a reaction to it, it may have been one more thing that adds to the middle of the toxicity in their body. But I don't know specifically. It's a little hard for me to answer that. If I had more information, I would tell you. But,
You know, when Gus Costanis was admitted in the hospital at the beginning of COVID, he was administered that, and all the side effects that he had were exactly what they stated. And so they're going through, unfortunately, a class action lawsuit for that. And when Gus went in, wouldn't let the rest of the family in, so isolation.
I remember hearing about that. 'Cause
Yeah.
I was actually on the phone with him like 2 days before that happened. He was calling me and said,
So,
Gus, what's going on? Yeah, here's that. But I'm sure it didn't help anything. I mean, there's some actually thinking that it was a repurposed medication from something that they didn't think worked in the first place.
Doctor, thank you. I'm here because I'm a journalist, and when you asked about the agenda, I just couldn't help myself but not to share this, that in September of 2021, the agenda was to have seasonal mandated vaccinations for all of the coronaviruses, that the gain of function coronavirus people, when they go to the bat caves, that is the basis of the business model for the vaccinations going forward. And that came out of the White House Office of Science and Technology.
And I can tell you that from a lecture that I listened to, the profits were astronomical to Pfizer. They were making
Absolutely.
41 billion 1 year, and the following year they made 81 billion.
Right, and Moderna had actually given to some of the Harvard business alumni their plan before COVID even broke out.
Yeah. Well, I think it goes back as far back as the whole John Hopkins thing in 2014, right? It was in their whole
2014 was there, but they actually, there's a retired lieutenant colonel who's a friend of mine. His name is Jim Zitlow. He was appointed by Secretary Gates in 2007 to create the military pandemic preparedness plan. It was implemented in 2009. There were no quarantines except for those who were sick. There were no mandated vaccinations. There were no mandated masks, and there was early treatment. And something happened, obviously, between 2009 and 2020. All hell broke loose.
Yeah. Thank you for sharing.
Sure.
Dr. Winkler, thank you for your presentation. My name is Dr. Marolia from India. I've been practicing homeopathy for the last 34 years in my practice. So you mentioned about using homeopathic remedies as a detox. Could you throw more light on your approach to using homeopathy in your practice?
So if you're a classic homeopath?
Absolutely, sir.
Good for you. I never got to learning that much. I just study on my own and learn more homotoxicology. So I was using more of the German products, the Heal products, the Italian Gunnar products. So a lot of it's based on what lectures I've listened to and learned from the use of homotoxicology, which is not you're more specific to different remedies that you're looking for based on patients' constitutions and other things that I understand. So it's a different approach, and so all of these are more lower dose 6X.
Or the 6X.
4C type of products. I don't think they're going to go to the 30C, 200C type products. Right, so it's a little bit of a different approach. But it was the ones that essentially are pre-made. I don't really spend the time other than testing out what I think they need, but I don't spend the time like you would in trying to get actually a very specific remedy.
All right. Thank you very much.
Yes,
Thank you.
Thank you.
Yeah, so since I have stage 4 breast cancer and I've been on chemo for a while, I've had issues with blood counts. I've had to have a few blood transfusions here in Florida, and I just wonder, I don't think they're testing blood for people who've been vaccinated or whatever. So like, is there still issues like this long? Like this year I've had 2 blood transfusions. So this far away from COVID, is there still issues with, we could get things from the vaccinated blood through a transfusion or something? Because I never got vaccinated myself. So I didn't really like the idea of having the blood. Wasn't sure if I would be exposed to the vaccine that way or something.
Right, so you received transfusions?
Mm-hmm.
So we don't even know if you received any spike from the...
Yeah.
Okay. So you really don't know how much you have in your system. Has anybody checked it?
I didn't even know where to go for that, so.
Most integrated physicians can do lab work. I mean, LabCorp can do an antibody for spike protein.
Okay.
Right. So I always again look back at what is the underlying problem, because a lot of times when you get sick, it's usually the straw that broke the camel's back. So what's all the stuff on the camel's back you need to get off? So is there mold? Is there heavy metals? Is there other environmental pollutants? We don't just get sick because we're randomly getting sick, right? And autoimmunity has always been said that this is more of an infection. So there's something else going on. Why do we carry infections? Because our immune system's weak. Why is the immune system weak? Because it's toxic. Everywhere that I look and the more I study and try to figure things out, it always comes back to the same answer. We're toxic. And what are we going to do to clean ourselves up? So I would really spend the time digging through like what you've been exposed to and getting it cleaned up. Because then the body can actually respond on its own. If it's not making bone marrow, then what's stopping it from making bone marrow?
Well, the chemo.
There's a really good lab in Germany. I've only used it once or twice. It's an IRD, or it's a German lab. It's a little expensive, but they will tell you the exact chemical that is on your DNA that's blocking certain functions.
No, you don't know the name.
I'll look it up again.
Let us know. We'll pass it on.
Yeah.
Okay.
It's a little pricey to do, but it's a really good lab if you want to know that information.
Yeah, that'd be great.
Yeah, that's good information. I think there's another question. Hi, Christine.
Hi, I just want to add to the woman who just talked about the blood. NIH has been collecting blood since January of 2021. I was interviewing COVID vax injured as early as January 2021. Many of them were healthcare providers. So NIH was doing a study, and then they stopped talking to some of the people that they took the blood from. And they took it on site. They even talked to some of their doctors here in the United States. So they do know, and they also know that there are, as a result of the COVID vaccinations or shots, I agree with you on that, these jabs have vascular and neurological injuries, and NIH, FDA, CDC, the White House, all the agencies have known this since as early as January 2021.
Well, that's pretty criminal on their part to keep this going.
Thank you, Christine. We have a couple of more questions over here, but I wanted to say that I was reading, I'm a researcher, so I was reading an article not too long ago about a company that is starting a lab for what they're calling purebloods. So people that have not been vaccinated, so that when you're in a serious, you have an injury or an accident, I don't know if you'll have access to it everywhere in the U.S., but at least it's starting to sort of come on the scene. So that was a little bit encouraging for me.
Julia.
I don't know.
Julia. The only reason I came up here was to share that there is a website called safeblood.com. And it is where people can connect that have not been vaccinated with people that need blood transfusions.
Thank you. You're a rock star there, girl.
Thank you for doing
Thanks for that information. Can you write that down for us?
Thanks.
Save Blood.
SAFE.
We'll put it on our website, and we'll also put the name of your diagnostic team in Germany.
There's a backsided question to that, though, because if you have a trauma and you have to quickly have a blood transfusion, is the hospital going to accept that blood coming in?
No.
Okay, so do you have to get some kind of contract? This wasn't my question, but now I have this question. So is this some kind of a contract that you have to have with the hospital saying, yes, we'll bring, because they don't even let people have transplants if they haven't been vaccinated. You know that, right? So that's just a concern. So you do all this. I was thinking before, this is a great business to open unvaccinated blood banks, but are they going to let you use the blood in the hospital setting? That's the main question, or what's the point, right? Yeah, but at least, okay. It's like, I hate to waste all that good blood. Okay, so my other question is to you. My concern, okay, I also have a practice. I do fairly well with the spike protein. I have a testing thing. And there's the blood, like you said, the blood test for spike protein. But did you think it was odd that there did the least tested, most questionably safe vaccine intramuscularly instead of sub-Q? When sub-Q is what 90% of vaccines are given, the route is what they're given. I thought that was really strange, and nobody asked the question. And then the other question was,
You may not get an answer.
Oh, okay, but don't you, as a physician, I mean, you know that they're given sub-Q,
I
the
think
tested ones.
The vaccine should have been given this, it should be a spray.
Okay, and my other conflict today was Dr. Contreras was talking about vaccines, and so you're like, are they good? Are they bad? So that's conflicting for people who are trying to figure this all out. So, I know it's a different vaccine, but let's call them different names.
Vaccine's a dirty word now, right?
That's what I'm saying. Thank you. That's
No
what I'm
one-
saying.
No one likes the word.
So he's
whether
saying
it's jab
vaccines,
or
yeah.
injection. But if you're actually, I've stopped using the word dendritic cell vaccine. I use dendritic cell therapy or dendritic cell treatment, because I don't think you want to add the word vaccine in there, because it sort of gets people off an alarm right now.
Yeah.
So, because most of the people in my office either don't get it, if they got it, they regretted it. So those are the kind of people I'm seeing. So,
Okay, we have to get to the next
Right.
question. I'm
Yeah.
sorry, sweetheart. My question is, like, when you offer detox for vaccines, how long do you offer them, and how often?
the standard protocol is like 3 months for this. If they're symptomatic, will continue with only probably a modified version of that. But it's the big thing for me is getting them in for the IVs. I think IV treatment is just going to work so much better. I mean, years ago, I think it was Gary Gordon said, an oral version of chelation is equal to 1 IV. So if you can take supplements for a month, we get 1 IV, what's your choice? You know, if you get the IV, it's done. It's much easier, and it's going to work faster. And I think you get more of a therapeutic benefit. So getting people in for weekly treatments starts cleaning these things. Then you taper them, and you get them back again. We've seen this with mold toxicity. They carry them in. You know, families carry them in. They're not walking. In 2 weeks, they're smiling, laughing, and back to normal because they were in 3-4 times a week for treatment. So we taper it, get them well, and then they continue on a more of a home detox program. But it's a matter of burden. It's a matter of toxic burden of the body. The more you get out, the easier it is to get repair work done. Okay? All right, thank you.